my name is Hinal Gandhi, and I am going to talk a little bit today about parental stress in the Pediatric Intensive Care Unit. So I am doing my synthesis in the Kentucky Children's Hospital Pediatric Intensive Care Unit, better known as the PICU. And a little bit about the KCH PICU is that this is a 12-bed facility that sees everything from acute respiratory failure to sepsis syndrome, some multi-system traumas, and we also do some recovering of post-op children. So these are children who have had, say, double lung transplants or any big surgeries that require continuous medical observation. All of the children that are in the PICU require very astute and continuous monitoring. And the patient age range for us is anywhere from newborns to adolescents. The KCH PICU is truly a multidisciplinary environment that includes at all times on the unit an attending physician, a resident or two if needed, a nurse practitioner, a respiratory therapist who is stationed on the unit, the pediatric pharmacy that is just across the hallway, and then of course the nurse. But the awesome thing about the KCH PICU is that they do an awesome job of integrating parents and families as part of this multidisciplinary team. And that's done to deliver just a really focused and thorough care for this critically ill or injured child using this family-centered approach. So we do see a lot of various illnesses and injuries in the unit. However, one thing that is universal and unfortunate is parental stress. And this happens for quite a few reasons. One, because they usually have a child, or they do have a child who is critically ill. Remembering that the PICU is an ICU setting, these kiddos are only there because they are so sick. They are there because they are on a ventilator, or they are just incredibly ill or have life-threatening injuries. And so just by the nature of the circumstance of having a critically ill child, parents are naturally stressed. Another stressor is that these parents feel very helpless. The parents have, for this child's entire life, have always been the comfort providers, the ones who have been able to fix any problems in this child's life. And now their child may be so ill or so in need of just medical attention that they feel as if they are not able to do much for their child, and so then they feel helpless. This brings on a lot of fear of losing the parental role, and it is just an incredible stressor in the PICU. So there's a variety of parental needs that need to be addressed, and stress stems from those needs not being met. An article that I read outlined the details of parental stress in a PICU setting, and it explained that nurses are often not aware of stressful factors or the interventions that are helpful for parents. So here are some common needs and stressors of parents. I know this is a little hard to read, but I have blown up copies for you so you can see a little better. Some of the major needs of parents as shown on this table are receiving information about the illness and prognosis of their child. It's very important that they receive timely updates on their child's plan of care, just so that there's no room for fear of the unknown. Having questions answered honestly goes along with this, as well as reaching out to the family at home if they're not in the unit. Having those clear, open lines of communication is a huge way that we can meet some of these needs for these parents. It's just important that the parents still feel like parents by knowing that their child is comfortable. On the opposite side of this, we have some stressors. Some stressors include not being present when the physician comes by to examine their child, or not knowing what to expect due to poor communication. A highest priority need reported by parents is having unrestricted access to their child. So, what can nurses do? Well, that article that provided the common needs and stressors of parents also provides evidence-based interventions in an algorithm form that nurses should implement or can implement to decrease parental stress in a PICU setting. A vital intervention, according to that algorithm, is the primary assessment of the family's anxiety, and this should be done on the first day of admission into the unit. It's natural that having a sick child in the PICU is going to bring about frustration, anxiety, sadness, definitely helplessness, and that fear of loss of the parental role, and oftentimes guilt. So a thorough assessment of the family's stress and functional status while having a sick child should be performed before attempting to decrease their anxiety. And this is so that we know where to start, and also so that we know their functional status, just to know how we can best accommodate the specific family. For example, parents may have financial concerns, or other children, just other responsibilities that only add to their existing stress. And after assessing these stressors, it's time to start meeting some of the needs. So, like I said, that highest priority need reported by parents is having unrestricted access to their child. And this includes being allowed presence during painful procedures, having no limitations on visitation hours, and participating in as much direct care of the child as possible. Again, we just don't want them to feel like they are not able to protect their child or feel as if they're losing the parental role. And involving them in as many interventions as feasible can just really help to relieve this notion. So, at the KCH PICU, it's amazing to see that a lot of the interventions mentioned on this algorithm are truly implemented. On that first day, the nurses are very diligent about introducing the entire healthcare team to the parents, so that the parents always know who will be in contact with their child, as well as introducing the purpose of each piece of equipment that is being used and why it's being used. There is definite facilitation of sleeping arrangements. We have sleep rooms that parents are welcome to stay in, and this just helps to remove any perceived restrictions or barriers on the time that they may feel they have to spend with their child. Social work or child life is consulted in a lot of patient cases, allowing parents to receive helpful resources to alleviate those other stressors that they may have in their life. And this is all done with the intent just to assure that the parents can focus on their child and work with the healthcare team with minimal distractions, so that together we can reach desirable outcomes. A lot of the alarms and monitors in the ICU can cause stress to parents, but the KCH PICU lets parents know what each alarm means and what is being done about it. The best way, I think, of decreasing parental stress in the PICU is our daily rounds, and those include the entire healthcare team every morning getting together to discuss the child's plan of care and goals for those days and for that day. And the parents are heavily encouraged to join in on those rounds, so that their input and their questions and their concerns can all be integrated into the plan of care. If the family is for any reason not able to be there, the nurses are diligent about updating them on what was discussed in rounds that day. Also, there is a whiteboard with an updated care plan that is to remain in the patient's room at all time, and anytime the care plan is adjusted, that whiteboard is adjusted, just so the family can always be just up to date and on top of what the plan of care for their child is. Additionally, for children who have been in the PICU for an extended amount of time, the healthcare team routinely conducts care conferences with families, and this is to discuss options that maybe need a little bit more time than just those daily rounds would provide. So this is for long-term options such as a tracheostomy or rehabilitation after discharge from the PICU, or sometimes even palliative care. But these are absolutely done, and they're very inclusive of the parents' desires and opinions for those children that are there for an extended amount of time. So enforcement of parent involvement and clear communications are interventions that are absolutely implemented in the KCH PICU. All of the interventions that the KCH PICU does to involve parents is proven by evidence to decrease parental stress in the pediatric ICU setting. So that is all I have for you. Thank you.